since the 1980s, we've introduced over 100,000 chemicals into our environment. And a lot of those chemicals are disrupting hormones. You remove the ultra-processed foods, within 3 months, sperm improved and AMH almost doubled in the women. Fascinating.
Wow.
Fertility challenge, it's literally the body saying, like, I have bigger fish to fry. I can't prioritize this. It's like, it's the first system in a woman that will shut down when there's too much stress on the body, right? She loses her period or she stops ovulating. I always say perfection doesn't equal pregnancy. So it's really like, I try to meet them where they're at. Like, some of my patients have to wake up early and they have to be on a screen and they have to work. Okay, so what can we do? What kind of modifications can we make to support them? Don't ask a woman when she's going to have a baby.
I know. I never do, but I know people that, people struggle with that.
They do.
They do. It's really tough to see.
This is Skin Talks, the podcast where we go deeper than skin, products, and trends and explore the conversations that actually matter in health, beauty, wellness, and confidence.
We're a mother-daughter duo and the founders of Boutique Skin Envie. After years inside the industry, we've learned that health is never just about what you use. It's about everything you digest, how you think, how you live, what you eat, how you move, what you put on your skin, and how you feel in your own body.
If you're looking for insight, honesty, and a fresh perspective on the future of health, beauty, and wellness, you're in the right place.
Let's get into it.
Skin Talks podcast by Boutique Skin Envie, hosted by Beate and Natascha.
On today's episode, we welcomed Aimee Raupp, who is a wellness and fertility expert. We spoke all things fertility, and I'm not going to dive into it too much, but I really think you guys should listen to this episode. It was just so important. And if you know anyone who's struggling with infertility, please share this episode to them. She gives so much information, and it was just such a good episode. So welcome to the podcast, Aimee. Welcome, Aimee. We're so excited to have you on today's episode. This is such a fun conversation. We haven't had one yet, and really feels close to home because I'm newly postpartum. But first, before we dive into the conversation today, can you please tell us a little bit about your background and how you became focused on fertility and women's health?
I've been in the practice of helping women get and stay pregnant for 21 years. My original education is biology and chemistry and plans to become a medical doctor. I'm a self-proclaimed medical school dropout, and I was studying neuroscience and biology at the graduate level and planning to go into medical school, and then kind of discovered the world of Chinese medicine, which acupuncture is one facet of Chinese medicine. Chinese medicine's, nutrition and lifestyle and acupuncture and herbs. And that changed like the trajectory of my life, I would say. I decided to enroll in Chinese medicine school. I was in San Diego at the time in California. And that changed everything for me because I think I was kind of the way you're trained, I was super micro focused, and Chinese medicine is very macro and looking at holistic. So when I got out and I was practicing, I was really just seeing general medicine, but most of the people that were coming to Chinese medicine at that time, 2 decades ago, were women. So I wound up dealing with hormonal issues, right? I would see period issues, menopausal issues, fertility issues. And I think the scientist in me, which, I was a scientist for a long time, got a bit hooked on that positive end result. Like, there's either a baby or there's not, right? There's either a positive pregnancy test or there's not. We could see hormonal shifts on labs. And so it just became what my passion was. And one thing led to another. And I started writing books. And when I wrote my second book, Yes, You Can Get Pregnant, which I just did a revision on 10 years later, when I wrote that book, that changed everything. Women from all over the world started reaching out to me. We didn't even have Zoom back then. It was Skype. People introduced Skype. Adults, do you remember Skype?
Yeah,
I remember in my Brooklyn apartment, I had a baby like that on my belly. I had just given birth. I got pregnant with my son right before I turned 41, and I conceived naturally. But I wrote Yes, You Can Get Pregnant, that first edition. I was 36. I was uncoupled. I was childless. But I'd been practicing for about a decade, and I knew enough. The revised edition is different because now I've lived it, right? I went through, fertility in my 40s. I had a miscarriage at 45. And so, I bring a lot more experience and nuance to the revised edition of Yes, You Can Get Pregnant. But that's really how it all kind of came together for me. It was what I was seeing in the clinic time after time. And I started to just see the same pattern of women feeling really disempowered and really kind of out of the conversation of their own life. Like, no, these are your options. When you're over 35, all your eggs are going to be bad and you have to rush to IVF. And it was just a lot of this. And I'm not against, I'm a big fan of Western medicine. I work with a lot of doctors in tandem, have a ton of respect. But there are so many pieces to the fertility puzzle. And now, fertility rates continue to rise. And so, yeah, it's just an important conversation to keep having. And I love doing it because I feel like one of the biggest missions I have is to give women back and their partners back the power over their health and their fertility and the decision-making process that, is involved in all the steps.
Yeah, that's really interesting. That's
I
amazing.
love it.
Yeah.
I love it. I think it's so important because, so many people silently suffer, right? And the fact that we can have these conversations, and all of these conversations we see more and more opening up through social media, podcasts, YouTube, all of this stuff. It's really important that people know that there's some options out there and there's support out there to help them. And it's not like in this shame cupboard anymore of, you're having issues with fertility and therefore like nobody can talk about it and, you're alone in it.
Or there's something wrong with you.
Yeah, exactly.
Which leads me to my question is, do you find that men and women are struggling more with infertility, or is it just more of a topic that's being talked about? Like it's more open?
The struggle is real and the incidence is increasing for certain. When I wrote the first edition of Yes, You Can Get Pregnant, it was 1 in 8 couples were struggling with fertility challenges. Now it's 1 in 6. And then now in the last decade, since I wrote the first version to the second version, the male factor fertility challenges we're at 50% now. 50% of fertility challenges are male factor. 10 years ago, 12 years ago, I also think we weren't looking deep enough. So that's part of that issue for male factor. But we were talking like 20 to 30% we thought was male factor.
Mm-hmm.
Oh, okay.
Why do you think that is? Like, what is the contributing factors to that?
There's a lot of hypotheses out there. The research seems to really support the endocrine disrupting chemicals in the environment for sure, lifestyle factors, metabolic health issues, the same things that are impacting women. I think since the 1980s, we've introduced over 100,000 chemicals into our environment, and a lot of those chemicals are disrupting hormones. And so we see that. I do think the poor quality of food, ultra-processed foods have gone up significantly. There was an interesting study that I talk about in the newest version of Yes, You Can Get Pregnant. It showed the impact of ultra-processed foods on both male and female. So a woman's AMH they were studying, and then sperm parameters, and a diet full of ultra-processed foods, low AMH and poor sperm. You remove the ultra-processed foods within 3 months, sperm improved and AMH almost doubled in the women. Fascinating.
Wow.
You think about that.
Sorry to interrupt you, but I've also noticed that I have a friend who has a daughter who's 6 years old, and her doctor was saying that this is not fertility, but younger girls are getting their periods much earlier because of the processed foods, the sugars, all that stuff. So not only is it affecting women in their fertility, but also girls are getting their period much, much earlier in their life.
Yeah, there's a lot of endocrine disruption is what I would say. Even what I, again, when I wrote the first version of Yes, You Can Get Pregnant, a Chinese medicine background, talk a lot about getting in touch with nature and like living in accordance with the Tao, we would say. And so, following the seasons and getting morning sunlight, like all of that, super important. Now, a decade later, we have so much research showing the disruption of blue light on melatonin, hormone production. So our circadian rhythm is really impacting our hormones as well. And then you can see that even in the younger children, it's the quality of the food. I think it's also the quality of the nutrition when the mom was pregnant. You know what I mean? It's like it's environmental factors, and not that anybody's to blame. I'm not saying that, but more that the quality of our environment and of our food sources has severely declined in the amount of, we get into it, the amount of pesticide use, all these things. It's just, it's a lot. It's a big burden on our body. And so the way I always perceive fertility it's the body saying, like, I have enough resources to make a human. I mean, you just made a human. Like, it's a big job. It's the biggest job a human can actually do is to make another human. I mean, it's
Yeah.
actually fascinating if you think about it, right?
Yeah.
And so with fertility challenges, it's literally the body saying, like, I have bigger fish to fry. I can't prioritize this. It's like it's the first system in a woman that will shut down when there's too much stress on the body, right? She loses her period or she stops ovulating. That's really quite normal from an environmental stress perspective. And so now I think we're actually seeing that almost like in mainstream just from all of these outside assaults.
Interesting. Now, do you think birth control has any effect? Like, I remember hearing that the length, like, it could be a total lie or myth, but the length of how long you take birth control could have an effect on your fertility. Like, is there enough study to that?
So there's a lot of studies around birth control and the nutrient deficiencies that it imposes because
Okay.
it blocks ovulation. Ovulation is a really important cue for a woman's health and vitality. I mean, we know that, I'm 51 now, we know that as we're like entering the menopausal years when we're not ovulating anymore. I mean, it's a big rush now of like hormones and all these things because everything stops. We don't ovulate. We don't have progesterone anymore, right? Like our DHEA
Estrogen
declines,
diminishes. Yeah.
estrogen diminishes. So birth control puts you in this holding pattern and you don't ovulate. And then there's all sorts of, we'll just say generally speaking, there can be a lot of micronutrient deficiencies that can be impacted from taking the birth control. And so then you're inherently deficient in your B vitamins, which is really important in hormonal synthesis, your D vitamin, vitamin D, which is actually a hormone, not a vitamin. So yes, I think the impact is there. I do think women can get off the pill though and restore themselves. I don't want anybody to be scared. It's like you can get
Yeah.
off and you do have to take it seriously though and restore. A normal ovulatory function should come back within 6-ish months after going off the pill. But you do need to dial in on all those micronutrients that you were missing while you were on the pill for all that time. So I don't know that there's a direct correlation though with the length of time, but that's not uncommon in my practice, right? A woman will come to me, she's 36, she wants to have a baby. She's been on birth control since she was 16, 17 years old. So we don't know what her period looks like. We don't know what her hormones look like. It's like I'm meeting a new person when she gets off that,
Yeah,
Yeah.
absolutely. And we also know that today women or people are waiting longer to build families, right? So it used to be that, my mom was just shy of 18 years old when I was born. And that was not entirely, it was unusual, but not crazy unusual. Today, it's very unusual.
Well, you were
that
shy
happens.
of 26.
I was shy of 26,
And I
which
just
is
turned
young.
31.
In today's world, it's young. And so you say, somebody at 36, they've got their career established, they finished school, they're, but maybe bought their first house. Like they're ready now to introduce a family into their world and have children. But then they face challenges in getting pregnant, right?
Yeah, and that's been the argument for quite some time that it's age related.
Yeah.
I
Yeah,
think
and
what
is
the
it?
more current research is showing us is it's more mitochondrial function related than actually like chronology. So meaning not necessarily how many years old you are, but really how well your body is functioning, how optimized it is. I've helped women up to the age of 48 get pregnant with their own eggs, which not everybody wants that, and that's fine, but some do, and some are waiting longer. I do think you can optimize fertility. I mean, I definitely think that whole fertility cliff conversation has been dismantled quite a bit because, and there's a decline, sure, with age, but it's more like a slope. It's not a cliff. There was a really large research study looking at 20,000 eggs. So women undergoing IVF and just their eggs, not embryos. So they weren't fertilized with sperm. And they showed that women, even in their late 30s to early 40s, chromosomally, a lot of your eggs, like 60-ish% of your eggs are still completely normal. So it's there. It's more the environment in which they develop that impacts things. And then also the environment in which the sperm develops, the environment in which the embryo develops once inside the woman. So those are all the things like we're learning. I always point people to like look at regenerative medicine because now we're really understanding it's less about chronology and more about biology, right? So like how how old your cells are, not number of years old, but like how well they're aging, which is so
Yeah.
much of what you guys probably talk about too from a skin perspective, like that
100%.
vitality, that the elasticity, all of that, you can tell a lot by how someone's aging by looking at their skin, actually, I think.
100%. We couldn't agree more.
Yeah. So let's say somebody comes to see you and what is the process when somebody comes to see you? Like, how do you, I don't know what the verbiage is, but like diagnose, I guess,
Like
whatever, or
Yeah.
a routine to get them into a better state for fertility?
So I call myself a fertility detective. That's kind of what I do, right? So I'm like this, I'm like in the trenches and I'm digging through everything. And so Chinese medicine, right? So I have this Western background. I know a lot about all the labs and all the tests and all the things. Chinese medicine is very, subjective, and I'm asking lots of questions of what are your bowel movements like? What's your sleep like? What's your energy like? Lots of period questions. What does the blood look like? How's the flow? What's your ovulation look like? Gives me lots of information. I ask a lot about the partner, if they're partnered and using his sperm. That also gives me a lot of information. And then typically, when I'm seeing patients, they're coming to me, they usually have a history. They've been trying to conceive for 2 years. They've done X amount of IVFs, or they've seen this specialist and this specialist. I can, but I don't always. I don't typically get women like preparing for their fertility, that'd be easier. It'd be an easier job because I could do a lot then. But so we have to kind of unpack and look and be like, okay, what tests have done, what haven't. A lot of things are overlooked. Not everybody's looking deeply at a woman's thyroid, say, or her vitamin D levels. Both are very clear in the literature. If the thyroid is in a certain range and vitamin D is in a certain range, fertility is not thriving. You're going to have a hard time getting pregnant. You're going to have a hard time staying pregnant. So some of it's that, like just dialing in on basic labs. Looking at insulin resistance markers is really important. Looking at inflammatory markers. And then I'm doing that too from like my diagnostic perspective from Chinese medicine. There's a lot like the skin will tell me there's a lot that like how's your hair, skin, and nails growing. Again, your bowel movements, your energy levels, like headaches, joint pain, things like that. Like a lot of people will tell me, I have a question I ask, like, how often do you feel in optimal health? Like, do you feel 50%, 75%? Most people feel like 50% good health, and they're 36 years old. I'm like, no, that's no, like that's, again, going back to that like safety conversation. The body's just saying like, I have other things going on. I don't have time to really prioritize this. And then you can equate some of this to maybe egg quality or sperm quality and think like, well, there's a lot of, use catchphrases, inflammation and oxidative stress that's impacting mitochondrial function and impacting fertility outcomes. So we're doing a lot of that. I also use functional medicine testing in my practice now, and refer out a lot too for additional diagnostics, and then put the whole piece together.
That's amazing.
We're looking at like IVF protocols. I mean, I dive into all of it. Yeah.
That's amazing. I love that.
No,
it's like really going, I like the Chinese medicine approach to it, like looking at it much deeper.
From a different lens also, right?
It makes total sense. And like, I haven't really like thought about it. I think it's very, very fascinating.
Yeah, it is fascinating.
And so
we say like we have to have enough blood. Like we don't have estrogen in Chinese medicine, right? There's no such thing. Like we talk about yin and blood and qi. And so there's a lot of diagnostics around that. But to us, they're like our vital substances. And if they're not like abundant, like we want a cup overflowing, with this abundance, that's when we're like, oh yeah, she's good. She's going to go make a baby, or like he's good. Like, yeah, healthy sperm, healthy baby. A lot of people come to me, they're really depleted, on many levels. And so even emotional depletion, so it's really about like restoring, and it's not about perfection. And it's not about like everyone has to have their cup overflowing. You can obviously get pregnant depleted, but I like to think about it macro as well of like, but if you're depleted and then you have a baby, you're not, the baby's taking more from you, and nature's really smart. Baby will take what baby needs. You're going to be in bad shape for a year and a half. Like that's where we have the postpartum issues, all that. So I'm always thinking bigger picture, like how can I best support, mom, family, and baby's health to them.
Yeah.
So everyone thrives.
So once you've done all of these different, analysis, diagnostics, question intakes, and gathered all of your information, what's the next step in helping people to become to be able to make a baby?
Yeah. So
Other than the obvious.
if I'm in my clinic,
Yeah.
what was that? Sorry.
Other than the obvious.
Other than the obvious, I know people are always like, "Hey, this is Amy's baby." I'm like, I was not in the room. It's not my baby. I'll take some credit, but there's credit due otherwise. So if I'm in my acupuncture clinic, right? So Chinese medicine again involves acupuncture, herbs. So the diagnostics, I'm still asking lots of questions and putting their case together. I'm feeling their pulses. I'm looking at their tongue. I'm looking at their skin. That's a diagnostic tool. And maybe I'm palpating and I'm coming up like, is she qi deficient? Is she blood deficient? Is she stagnant? Is she hot? Is she cold? Using acupuncture as one tool to improve circulation and blood flow. I am an herbalist, so I'll use Chinese herbs as well based on my diagnosis. I tend to do a lot more virtual work these days, just the way my business has shifted and grown, and reaching women that I may never meet in person. So we're working on diet. We're tuning in on supplements. And not a single patient gets away without sending me a food diary for at least 5 to 7 days. And I want to see what time you ate, how much you ate, how you felt after eating. Did your skin get itchy? Did you get diarrhea? Did you get heartburn? Like all of that, like really helps me understand kind of how everything's working. Then we're targeting supplements. I'm probably looking at lab work and my diagnostics and targeting supplements, making lifestyle recommendations, things like getting morning sunlight or not looking at your device while falling asleep, not like doom scrolling. We know the blue light's impacting hormones, like for certain. That's in the data. It's not, I didn't make it up. It's not mine. It's like, it's clear. So we're making lifestyle modifications. A lot of people skip meals, don't move their body, don't go outside, or on devices 24/7. So it's a lot of shifts. It is. I always say perfection doesn't equal pregnancy. So it's really like I try to meet them where they're at. Like some of my patients have to wake up early and they have to be on a screen and they have to work. Okay, so what can we do? What kind of modifications can we make to support them? But it's a lot of what I would like to say, getting back to the basics, really understanding what your body is trying to say to you, listening to the signals, and then supporting it. And then you see the period shift, you see ovulation shift. If you're testing hormones, you see that shift. If they're doing IVF, you see better outcomes. It's pretty awesome, actually.
And so does this differ from, let's say, somebody who's gotten pregnant before but has suffered from miscarriage? Like, is that a different approach, or is it more or less the same thing?
It can be the same thing.
Yeah.
Well, I know there's a lot of talk out there about with fertility that it's always the woman and her age and her egg quality, right? There's like a very popular book out there that says it's something like it starts with the egg. I think it's what it's called. So much pressure on the woman when it comes to, and that I think is important to dispel and talk about and like lift that conversation, because it's just so much pressure on us for so many reasons, but B, it's not the whole case. And so what I always say, like, especially like the miscarriage case, is yes, egg is important. Sperm is as important. The uterus is just as important. So there's cool testing out there now looking at like the uterine microbiome. I mean, if someone came to me and she'd had a couple of miscarriages, I'm thinking about certain labs I'd run on her. Like, could it be her thyroid? Could it be there's called clotting factor issues? Could it be there's a low-lying infection that some women get in the uterus for no reason? It could be secondary, though, if they had a C-section. It's called chronic endometritis. More and more doctors are testing for it. But
Yes, I've heard of this.
the structure of the uterus, she could have a septum. That could be the reason why. She could have endometriosis. That could be the reason why, right? So that's where my clinical expertise comes in. I mean, I've been doing this a really long time, so I can dial in and be like, okay, you're going to go to this person. These are the tests. In some states I can run the tests. Some states I can't. But still, we're still going back to like, could it be the egg, or the sperm isn't healthy enough? And that's why we keep miscarrying. Like, we know now sperm factor, male factor plays a role in miscarriage as well, and in placental development. So we're looking at that too. There's more extensive semen analysis we can do. It's called the DNA fragmentation test. So we're going to look at that. That's oxidative stress markers in the sperm itself. If there's a lot of inflammation, that could be a reason for the miscarriage. So we're still dialing in on those basics, but then there might be more, specific testing that I'm going to push for as well.
So that's really interesting because
very cool.
Yeah. And what you said before, where the sperm plays a role in the placenta, like more and more, that's a thing. But there's been this thing where they're saying that also like sperm plays a massive role on women's, my God, morning sickness. Is that like a fake news or is
Oh,
that actually real? Because I've been
interesting.
hearing that.
I have to think about that. Maybe. I always tend to think about morning sickness more of a blood sugar issue, metabolic issue with the woman. And as you're just, but there could be some sort of immune. So that's the cool this is a minority science person talking. That's a cool thing that we don't really quite understand yet is, and we're getting more understanding is, the embryo and the sperm are foreign objects, right? The embryo is half not us. And our immune system is meant to attack anything that's not us. Why do we accept this embryo, right? That's half not us, even the sperm. So there could be some like anti-sperm antibody kind of conversation in there of like, it could be causing some sort of immune response that then leads to the really bad, morning sickness. Potentially.
Yeah, because there's some people that suffer. Like my sister had a baby recently within the last 2 years. And she told me that she was basically throwing up her entire pregnancy, even during labor. And the minute the baby was born, it was gone. She
so
said
it could
was
be
the
some sort of immune tolerance.
Horrible. Like she really, really
But that
struggled.
was only with her. That was only with her daughter, her second child.
Yeah.
With her first child, she didn't have that. So
She had morning sickness, but not to the degree that she had it with her daughter. And like she said, literally, Beate, I gave birth and it was gone.
Wow.
So it was like something inside of her every single day. She really, really struggled.
So crazy.
Yeah. Let's talk about at-home skincare tools because most of them are either too weak to matter or too harsh to be safe. If you want professional level results at home, you need something clinically tested and designed by skin experts. The Environ Cosmetic Roll CIT is a medical grade derma roller that creates tiny microchannels in the skin so your serums can penetrate up to 80% deeper. It enhances results, it boosts collagen, and when used correctly, it's incredibly safe and effective. If you're going to invest in at-home skin technology, make it something proven. Use SkinTalks15 at Beskin Envie, spelled BSKINENVIE.ca for 15% off your first order.
There's an increased incidence in autoimmunity kicking in postpartum because of the immune tolerance that's required to hold the pregnancy. So it could definitely, I could see a reason. I don't know data, but I haven't actually dug into data around it. So it might not be a lie out there about.
I mean, they would say that it's because it was a girl. That's why she was nauseous. Like one of those.
They
like,
have a lot of.
Yeah, I know. Like the hair, right? The hair on the baby and all those. Maybe. I think we have more information now. It's kind of like legs up the wall after sex. I'm like, I'm not so sure, but sure, if you want to.
If you want to, if it makes you feel better.
Go for it.
I know people that have done that. Yeah, for sure. Yeah, it's a very, like when you are trying to make a baby and you're struggling to make a baby, I'm sure it's really hard for people. It's heartbreaking. But what I wanted to ask you is, when someone's hormones are out of balance, whether it be a female or a male, what are some of the early signs that people might notice in their bodies that there's something going on?
I think fatigue, headaches, poor sleep, not the same stamina, something I'll hear a lot in the clinic is like, after working out, like I'm just so sore, and that used to not be the case. To me, I'm thinking inflammation. I'm thinking the body isn't like detoxifying the right way, or like something stagnant, and so you're starting to see that. Mood swings are another big one that maybe people wouldn't necessarily correlate with hormonal imbalance. I think in women, we're going to see some cycle irregularities. In men, it might be the low sex drive. Like a man in his 30s with a low sex drive, not normal, right? So we have to dig into that. What's going on there? Or can't maintain an erection. That's low testosterone. Why? You know what I mean? Or low vitamin D. Why? Like, so we should dig into that more. Yeah.
That's very interesting. And so like, how can somebody like kind of avoid, like how can we maintain in our day-to-day life a healthy hormonal balance? If we start seeing things are out of touched, like how can you get that back into the normal balance?
Yeah, I think it is getting with the basics. I would probably start with nutrition, making sure I would say, I look at, I don't know, ten food diaries a week, if not more. Most people are, especially women, they're under eating, and they skip breakfast. And that is like intermittent fasting can work for men. It does not work for women,
I
Yes,
totally
right.
agree with you on this. And I've been
yeah,
hearing it more and more.
and low carb too. Low carb is like, it backfires on women. Like we need some carbs. Like even if it's like sweet potatoes and berries, it doesn't have to be bread or pasta. Like, and in fact, if you're going to do those, it should be good quality. But like the low carb, it almost like what, I tend to get women that are a little older. Like I'm very popular with the late 30s, 40-year-old women trying to get pregnant. That seems to be my niche. But what works for us in our 20s to like lose weight and be fit is not working anymore. And it really causes a hormone disruption. So I'm always looking at diet. And I have a goal, 30 grams of protein within the first 3 hours of waking. Like that's what our goal should be. Don't work out fasted. Those are the two most common things I see. And then there's this really long gap. Like, I eat lunch at 1 and I don't eat again till 8. That's like terrible for your blood sugar, which is going to impact your hormones. Men can get away with it a little bit more, but men tend to do better with, they can do the longer fast and then kind of eat from like 10 to 7 or something like that and get away with it. Women need that time in the morning. I would like caffeine too. That's another thing. I would look out how much caffeine they're consuming. That can start to backfire. I think caffeine is safe for trying to conceive, but like when and how you consume it is really important. And then sleep schedules. Most people will tell me, oh, like I get in bed around like 9:30, 10, and then I like watch a few shows and then I doom scroll. I don't really fall asleep till like midnight, and then I'm up. Gotta be up at 6. And it's like, oh my God, they're so depleted,
Yeah.
So then the body just starts to like, it just feels taxed. And so hormones, reproduction is really like when the body feels in crisis, reproduction is the first thing it'll push to the side because it's just,
It's got other
another
battles to
birth.
fight.
Yeah.
It's trying to maintain homeostasis and compensate,
That's right.
So it doesn't have the capacity to take on another task.
But they even,
That's right.
people also, like I've been, even for postpartum, I mean, obviously I'm in it. So they say also to help with postpartum depression or like baby blues and stuff like that, is also to get that 30 grams of protein right away in the morning. And I notice it when I don't eat, like right away. Like obviously I'm breastfeeding, so I'm starving. And if I don't have protein in the morning, like I can even feel myself a little bit off balance. Like I don't feel as good. So I make it like such a priority to have like some eggs in the morning and then eat my coffee, then drink my coffee. I try to remove my caffeine from like the first thing going down my throat.
Yeah.
Like
Totally.
I try to rebalance it.
Well, it's like it does. It causes the jitters, and caffeine on an empty stomach. It's like, it spikes your cortisol, and then that sets you up for failure the rest of the day in a sense,
Yeah. There's more and more conversations around waiting at least 45 minutes before you have your first cup of coffee, and also maybe drinking a big glass of water before.
I like wake up, I have water, my postnatals, kefir, then I have my eggs, and then I have a coffee.
Okay.
I just started doing this kefir thing because my friend told me to do it. I don't even know what it's doing.
Well, it's good for the microbiome, right?
Probiotics, exactly.
Yeah.
I'm like having a glass of kefir. I'm like, I don't even know who I am at this point, but let's just do it all. Let's just try it all at this point. Let's just
do it. No, but breastfeeding, I mean, in Chinese medicine too, we say like the breast milk production comes from your qi in your blood, and it's typically very depleted after giving birth and laboring, and then, we bleed and all of that. And so it's so important. Like your nutrient repletion right now is so important, because not just for your breast milk production, but almost the same thing, just so like you can produce milk and function. And so your hair doesn't fall out. And like, and to us in Chinese medicine, like the postpartum blues and depression is very linked to blood deficiency. So it's all about like, we love bone broth, and we love liver and like organ meats and like eggs and all that to really boost a woman's blood after giving birth. And that's the same thing too, of like, even for fertility, that blood is the most important piece. So I'm always like, I'm giving organ meats to all my girls.
You know, I actually had organ meat during my pregnancy twice, I think. What is it called there? The sweetbread. That's organ meat,
Oh
right?
yeah, that the
And you were
thymus, isn't that
struggling
the
with
other
that. And I
thing?
was like, honestly, like
Yeah.
I heard that it's really good. So I'm just going to eat it. And I had it like at a high end restaurant. So like it was delicious and
Yeah,
not
I
like,
love it. The sweetbreads, they're
but
delicious.
for like how do you, it is a little bit like touchy.
Yeah.
So,
Texture.
yeah. Like people
Yeah.
struggle with the
Oh, yeah,
texture.
you can
How do
take it
you
in pill
implement?
form.
Okay.
There's a lot of good companies like Ancestral or, I use Dr. Ron's, but they have, grass-fed, lamb or different organ meats, and you can take them in capsule form too.
So you
So
Okay,
you don't
that's a
have to
good,
eat
that's
them.
interesting.
instead of
I
actually,
like foie
Mhm.
gras, but
Yeah, same. So then that's goose liver, right? And so liver is actually like I call it nature's B complex. It's one of the most like nutrient dense foods that exist. Of course you want to eat a good quality liver too, and good quality foie gras is the best.
it's
Um,
delicious, but it's very high in
delicious.
fat and
Yeah.
there's
And you don't need
other,
a lot. Like I say, like if you're going to eat the pate, you have 3 ounces for the whole week. So think about that. That's not a lot at all. 3 ounces is the size of your palm. You know what I mean? I know if I had like a good baguette and some pate, I mean,
oh
I
my
could house the whole thing in like
goodness.
one
yeah,
It's
yeah.
like
sitting.
heaven on earth.
Guaranteed. I mean, the whole
Foie
It's
thing.
like
I
gras,
had it
really put
recently. Yeah. I
together.
was
Yeah.
eating so much of it.
so delicious. So delicious. Yeah.
And then also talk about for skin too, because we see it as like it's such a blood engendering food that, that's the radiance. That's like the luminous in our skin.
Yeah. I was going to
So
ask you
I
when
can
you
look at
look,
someone and I can tell. I can be like, oh, she's blood deficient. She's too dry. She's yin deficient. Her estrogen's probably low,
that
even
was
if
my
she's
question.
not
Yeah.
near perimenopause. Yeah.
Wow.
So like really like you can see somebody's skin concerns and really like kind of dissect what they're deficient in.
Yeah.
That's
Yeah.
so
Or even things like
interesting.
eczema, psoriasis, rosacea, those are all telling us like something's not happy on the inside. You know what I mean?
Yeah.
There's an inflammatory response going on. Now we have like red, itchy, oozy stuff. The dryness tells me, yeah, we're not getting nourishment. And it might be that you have a great diet actually, but maybe you're not absorbing. Maybe there's some sort of like bacterial overgrowth or something like that that's preventing absorption, right? So you're always kind of like, looking and dissecting, but skin is one of the most common things I ask about, when I'm trying to help diagnose a patient. If there's skin conditions, I'm automatically thinking like, okay, there's some sort of inflammatory response going on in the body. Why? What's going on? Could it be from their diet? Could it be from like something they're putting on their skin, or could it be emotional? When I
There's
was
so
breastfeeding
many.
my son, I was ready to stop. And I think we were like 10 months in, but I felt all this pressure just because of what I do for a living, the natural like health world. I should breastfeed for like 3 years. And I was like, I think I'm done with this. I started to get, and I'm an eczema person. I got eczema all over my left breast, like to the point I couldn't wear a bra. Like I was like, if you touch me, like I will die. It was like itchy, the whole thing. I had this realization. I had like a conversation with a good friend about it and about my frustrations and that I wanted to stop. And then I gave myself permission to stop breastfeeding, and then the eczema went away. So it was all for me, at least.
Emotional.
It was emotional. I talk about that in my book, Body Belief. I tell that exact story, and it was like what I call emotional inflammation, which and we know that now. Like there's plenty of data to support it. Of like, not just like our beliefs, create a systemic pathway, but it triggers the nervous system. Then you're in this fight or flight, and it can cause an inflammatory cascade, and you can manifest. You can have physical manifestations of the stress. I mean, we all know that.
Yeah.
But for
Yeah.
me, that was like a big thing. I was so pent up and frustrated, and so there was like an eruption happening on my skin from the inside out.
That's incredible.
Amazing. It's
Well, we
really
say it when
amazing.
we say it when you have like, let's say even melasma or rosacea, like it's like, or acne, it's inflammation in the skin, right? Like it's,
Yeah,
so
there's
obviously
something.
when you're having some sort of like breakout eczema or sorry, like something's
Yeah,
going
even
on that you have to
breakouts
look
too.
internally.
Totally.
Yeah,
Yeah.
and we
Totally.
also we
We say
also
it's
ask,
heat. Yeah.
yeah, we ask a lot of questions too, similar to like different, obviously a different subject, but we ask a lot of questions about, what are they eating, their dairy, their all kinds of stuff, because there's a lot of things like even processed sugars and processed foods and stuff like that. It all has a big effect, their emotional state, how much stress they have at their job. They come into us for a skin consultation and we end up talking about their lifestyle. A big majority of the conversation is about that because it helps us to understand what's going on
That's
with
right.
them on the inside and where we need to like maybe adjust and do some things to be able to get the best results for them. Do
Yeah,
you
and the
find,
work you're doing is very
yeah,
similar to what I do. It's
Yeah.
like the end result maybe is different. Although I would argue that you helping them and you're working from the inside out to help skin it's very similar. Like you're balancing hormones. You know what I mean? You're creating a more fertile, optimal environment too, if that was the goal ultimately.
yeah,
We love that.
Um, so all my patients, so like my skin's never been this good, all my, it's like my sleep's better, my bowel movement's better, like my energy, those are all the goals, of course, but
Yeah.
that's telling me, okay, now I have enough, like, and all these little kinks are getting worked out.
So when somebody comes to see you for the first time and do how many, like, what does the journey look like with them and how long does it take most people? I know you can't like say there's an average, but what is the time frame basically to bring their entire, like to
Body to
risk and their
homeostasis.
chi, to work on their
Yeah.
chi, all of that stuff so that they are ready to
Ready.
conceive?
I'd say 3 to 6 months,
Okay.
Oh, wow.
and that's also like I mean, I like to say, and this, I've been doing this for 2 decades now. It's pretty standard that by 18 months from when I meet my person, that they're either healthily pregnant or sitting like you with a newborn in their laps,
Wow, that's
and so
amazing.
what conception is 10 months. So, it's in that like 6 to 9 month time frame where things really start to click. But the first 3 months are the critical time. And then especially if they are partnered and we're working with the partners too, it's like we can get them there
Okay. And what
fairly
about
fast.
That's beautiful. I love that.
yeah, that is incredible. So I wanted to ask you, do most women or couples, are they coming to you before they try IVF? Are they doing it alongside
Ish.
or is it after?
It
Like, what is
depends.
the,
I mean, a
or,
lot of my cases now, like I think because I've been doing this so long and just, the position I'm in now in my career, I get complicated cases. So, I mean, I'll have cases that are like, have had 6 miscarriages, 7 failed IVFs. They've been at it for 7 years. I will get women that are like, okay, before we do IVF, I'm going to do it. I'm going to work with Aimee and I'm going to do all the things, to maximize. If they're in the middle of IVF treatments, usually I'm asking them, if feasible, I always try to meet people where they're at, but like, can we take a break for like a month or two and just like get everything in order? So we don't, I have rules around IVF, but one of them is like, do not keep doing the same thing over and over again and expecting different results because that's just insanity. Right.
Yeah.
yeah.
And we have to, and even with my patients, I'm dialing in of like what IVF protocol worked. What was your best IVF? What was your worst? What can we do about that? That's where my mad scientist comes in. But yeah, I get them across the board, all different spectrums of the journey, if you will. But typically, women are already into their journey a year or two before I meet them,
Yeah.
which is
And
hard. Like the
probably just
emotional, talk about the
desperate,
Yeah.
emotional
right?
piece.
It's very,
Yeah,
very hard when you
it's
want
so
to have a
hard.
baby and you can't, or,
Yeah.
it's,
I have a question. I've heard this also, like, women who got pregnant easily, let's say on their first child with their first child, struggle sometimes a lot getting, like, it takes a year to 2 years to get pregnant with their second child. Like, what's happening there?
So that could be some of what we talked about of like the depletion, right? That
Yeah.
you gave your all, and then you breastfed, and then you kind of like went back to life and didn't really. You're not the priority anymore, and so now we're skipping meals more. We're not
Okay.
sleeping enough, right? So that could be that pattern. Sometimes it can be the autoimmune thing that we talked about, where like pregnancy can trigger an autoimmune response in the body. So then the body becomes a lot less tolerant and maybe the thyroid's out of whack, or maybe now, you know, the immune system, there's too much inflammation and it's compromising egg quality. There could be stuff, I always am looking at the partner too of like, well, what's changed in his life in the last 2 years too? I'm always kind of dialing on that. Sometimes it could be a structural issue postpartum. Post delivery, if you had a C-section, especially, there could be scar tissue. It's called an isthmocele, which there's actually like a scar on the inside of the uterus from the C-section. And that can cause adhesions and that can cause the uterus to be misshapen, could impact implantation. There could be a uterine lining infection. So, yeah, there's lots of
Lots of
reasons
things, yeah.
why. And most people, standard people out there will be like, well, it's because she's 2 years older. And I'm like, no, it doesn't, like nothing changes that fast.
So,
That's
Yeah,
2000
let's move on
nothing
from that
changes that fast.
convo.
No way. It's gotta be, and it's usually, maybe it's a combination of all the things. Cause then, when you sit with her and you talk about it, she had all the time in the world to just take care of herself back then. And then now she doesn't. So it's like, we have to, always say like, I want you to think about how much of you're giving away every day, and how much are you keeping anything for yourself. And a lot of people are not at that point. They just, so it's about refocusing on you, and maybe your
yeah.
partnership is probably
Makes
having
total
less sex
sense.
because now you have a baby. There's lots of layers. Like, it's like, oh yeah, no, yeah, last time, yeah, we had sex every day through the whole month, and that's when we got pregnant. I'm like, well, can you do that now? Oh God, no. So it's stuff like that. There's usually lots of
For
reasons.
sure. There's a lot of different factors to
Yeah,
consider.
I
but I
relate.
do believe that we give so much. I remember when I had Natasha, by the way, she's my daughter.
I put it together. I did.
Yeah. My world revolved around her. And I also
Yeah,
had
and
a
in a
career.
beautiful way.
Yeah.
Yeah.
So I was giving everything to everything, and you really do get depleted when you're
Makes
not.
total
You
sense,
need
yeah.
to balance it out and also take time for yourself. But somehow I think a lot of women feel guilty to do those kinds of things, to really take time for themselves. They think becoming a mother means that it's the only thing that they have to work on and do every single day to be good at it and to like fit up with the standards that we have to uphold as moms or as parents.
Yeah.
It's a lot of pressure. So yeah,
It is.
I like that notion of recalibrating and really zooming
Yeah,
in
and
on
like
yourself.
also I think too, we're showing our children that we are still important when we say, no, this
Yeah.
is my time, this is for me. And that's such an important thing to show them. Like, no, I'm
Yeah.
actually really important, and how I feel and how I take care. I say nourish, that's my favorite word. How I nourish myself, like on all the levels, not just nutritionally, is really important. And then that allows me to be the mom I need to be, but also, to grow my family if that's what I want to do.
Mm-hmm.
Yeah,
Mm-hmm.
I love that.
It's not selfish to take
No,
care of
gosh,
yourself.
no.
No,
It's
because they
very
say
much
like
not
if you're
selfish.
taking care of yourself and you give yourself love, like you're gonna be able to like give more love, like
That's
you'll
right.
just be a better wife, sister, mother, whatever it
Yeah,
is.
but loving
Yeah.
yourself is the foundation of
Yeah.
everything, right? And we often we
Great.
put that aside to love others or to give to others.
Yeah.
You talked before about the books that you'd written. How many books have you written?
I love that she should think about it. It
4,
must be a lot.
5. So I've written 1, 2, 3, 4, and then this one's is a revision. So I guess technically 5 books. Yeah, that's crazy.
Amazing.
Okay.
Yeah.
So can you tell us a little bit about the books and what got you into
So
that?
the first one, it was 2010. It came out, and it was called "Chill Out and Get Healthy," and that was just a general woman's guide of like all the things to just be your healthiest self, if you will. And like a lot of Chinese medicine principles, a lot of talk about skin and emotions and all that, and beauty from the inside out. There was a chapter entitled "Beauty You Can't Buy at Sephora."
Yeah.
'Cause I wrote it 16 years ago. And then my next book was Yes, You Can Get Pregnant, the first edition, and then I wrote a book called Body Belief, which is when I was writing Yes, You Can Get Pregnant and diving into a lot of the unexplained infertility. That's a very common diagnosis out there, is realizing that it's never unexplained, and there's a lot of autoimmunity that's going on with it. And so Body Belief was my dive into autoimmune diseases, and I talk a lot about emotional inflammation in that book. I'm always kind of tying in the spiritual, emotional aspect to connect in all of my books. And then I wrote a book called The Egg Quality Diet, which is what the 100-day kind of meal plan. It's literally like 100 days of menus and meal plans, macronutrient balance for a woman trying to optimize her egg quality. And 100 days is important because that's the time frame of folliculogenesis. So like your little baby there, before you got pregnant, that egg was recruited 100 days, right up until ovulation. And so that 100-day period is what impacts the quality.
Oof,
So that's the Egg Quality Diet. And then I just revised Yes, You Can Get Pregnant. and put in like a ton more research. And, just kind of when I first wrote Yes, You Can Get Pregnant, I was 36 and uncoupled and without a child. And then now I got to come back to it like as a mom, someone who got pregnant in her 40s. I went through miscarriage, like, just kind of, and now my 20 years of experience. So I've really zhuzhed it up, and
I love that. Yeah.
it's good. Yeah.
Amazing.
A lot more
So
research, a
cool.
lot more data. It's good. Yeah.
I want to read the last one there that you wrote about the 100-day diet.
Yeah, I will.
love that.
Quality diet. I can send you. I'll send you some.
I would love to get
I
one
would
of
love to read
each,
all of them.
actually, and the fifth one too, the revised edition. I'd love to read that.
And I have a skincare line too that I should send you.
Yes, and supplements, right? I did a little bit of research.
Yeah.
So talk about that.
The skincare came out of my own skin issues, to be honest. I had eczema my whole life, and then I had acne in my 20s. I was just always a really sensitive girl. So like, they would tell me to use like Cetaphil for my skin. It would like cause me to break out. It was like, anyway. So in my 30s, I just started playing around with like all natural stuff. Like I went to Greece. And my friend's grandmother, she was in her 80s. Her skin was just like so juicy and plump. And I'm like, what do you put on your skin? Through my friend who translated, she says olive oil. I'm like, every day you just put olive oil on your skin? Like what? I mean, and then she's like, she's eating like duck fat though. Do you know what I mean? I was like, she had a great diet too. And she's like gardening all day. So I started playing around with olive oil and ghee and coconut oil. And anyway, then I basically crafted my own skincare that worked for my skin. And then I started sharing it with friends, and then people started asking. And so, my ritual or my premise with my skincare is that if you can't eat it, you don't put it on your skin. And so there's nothing, it's like essential oils and good quality oils and fats. And so I just made a new tallow cream. So it's fun. I enjoy it. It's like a little side hobby.
What's the name of it?
And it works. What was that? It's my name, Aimee Raupp Beauty.
Okay.
Yeah, I saw that on your website, and I was actually like, well, do you export to Canada?
Yeah, I mean, I can.
Okay, we'll have to have a conversation after. I'm always like looking for interesting, opportunities and things. And I really like what you do. I think it's very important.
Oh, thank you.
And I also read that you have some supplements.
Yeah. What are those?
Yes. So I've teamed up with a fertility doctor. He's a reproductive endocrinologist. And then a friend I went to graduate school with, who he's like, I call him the male version of me. Like we're both acupuncturists, and we're in the space of fertility and do a lot of this, virtual online stuff. And so we came up with our own supplement line called Rejuva, and we have an eggs formulation, a sperm formulation, and one that we call Repair, which is for the mitochondrial support.
Okay.
So it's very fertility specific. It's very niche. But it's filled with we have a blend of some Chinese medicine. There's some herbs in there. There's organ meats, and then NMN, is supercharged mitochondrial supplementation or things that are well researched, CoQ10 for egg quality, NAC, that kind of thing. So we worked with a formulator, we did it the right way and just went over all the research, and we're tweaking this next round, we're tweaking the Repair again, because we're going to add in a couple more of the newer things that are out there, like ergothioneine and astaxanthin to help these, there's just really fascinating research of what it's doing from a mitochondrial, DNA damage perspective. And so, it's fun. It's fun. Cool. It's been it's nice to share. That's the first business I've shared with someone else. And that's from a businesswoman perspective, that's really nice. It's really nice to not have it all on me.
Yes, definitely. We understand that. We understand that very well.
Yeah, totally.
This has been so interesting.
Yes,
and we really appreciate all of your enthusiasm, passion, and your knowledge from all the different angles, from Eastern, Western medicine, all combined, respecting both sides. Aimee, we always ask 3 signature questions at the end of every episode. And so I'm going to let Natascha ask the first question.
Yes. What is one thing you wish every woman understood about her body earlier in life?
She has a lot of power over it. That there's so much she can do to influence it, and to not let the outside world influence her so much.
I love that.
I do too. I really like that answer. If someone listening feels overwhelmed about their hormones or fertility, what's the first step you would encourage them to take?
like start with the basics, like what we just said, like 30 grams of protein within the first 3 hours of waking. Try not to go, skip meals. Don't go 8 hours between meals. Keep it simple.
I love that. And what does being truly healthy mean to you today?
I think it is vitality, but like, what is vitality? Do you know what I mean? It's like having the energy and the passion to do what you want to do, and to be able to show up as you want to show up in the world. Yeah.
Amazing.
So fun.
I love this so much.
Yeah.
I'm going to share this with all my friends.
Yeah. I've met a couple people in
I
my
enjoyed
life
this
that
a lot.
they've had fertility issues, and it's really hard on people
so
that are
hard.
struggling with that. And then everybody's asking them, are you going to have a baby? You're going to have a baby. And people, there's just like, it's hard.
Yeah. So what
It's
you
so
do is
hard.
really,
I
really
know.
Yeah, it's
Don't
very
ask.
important.
Don't ask a woman when she's going to have a baby.
I know. I never do, but I know people that, people struggle with that.
They do.
It's,
They do.
It's really
Hard.
tough to see.
Or when are you going to have your next baby?
Yeah.
Yeah,
Like,
exactly.
also-
Like you're probably going to get that like next week. You're going to start getting that next week. Yeah,
Yeah.
When's number 2?
Yeah, I know. It's just, I don't know. Some people mean well, but it's hard for people that are struggling in that.
Yes.
So I think what you're doing is really important. And we're definitely going to share all of your information when we launch
Thank
this
you.
episode so that people can get in touch with you. You said before you do a lot of virtuals.
Yes.
So, and I'm assuming that's not just in the United States. You also can do
Yeah,
that
it's all
internationally
over.
with people and really
It
help
is.
people. And I love that. So we want to make
Yeah.
sure to spread the word about that.
Thank you so much. And I appreciate what you are doing. And I love the mother-daughter duo. It's great.
Mhm.
Thank
And
you.
3
grandson.
generations right here. It's
Yeah,
so
yeah.
fun. I know.
I'm very lucky, very blessed.
Yes,
Thank
I love
you.
it. I love it. It's beautiful. It really is. So thank you.
Thank you for listening to Skin Talks.
If this episode inspired you, taught you something new, or just made you feel seen, please share with someone you love. And if you believe in thoughtful and empowering conversations that help you make better choices for yourself around your beauty and wellness, please rate and review the show. It helps us to grow our community, and we deeply appreciate it. Because this isn't just about skin.
It's about claiming your beauty, feeling strong, informed, and at home in yourself.
See you next week.